and I would like to talk about different topics today. The first is to deal precision medicine in oncology, to give you a short overview on that. Then to talk about liquid profiling for targeted therapies, considerations for the clinical application, liquid profiling for immune therapies, a very new hot topic, and then come to early cancer detection and the possibilities of circulating nucleic acids in plasma and serum for this topic. Let's start with the first topic, precision medicine in oncology. When in 2016, the World Medical Innovation Forum selected the 12 most disruptive technologies for the next 10 years, it was also liquid biopsy that was among them. But if you look at all the red colored items, you will see that all of them had to do with precision medicine in some way. What is precision medicine doing? So conventional cancer therapies like surgery, chemotherapy, radiotherapy, or endocrine therapy are systemic approaches, while targeted therapies like antibody therapy, small molecule therapy, immune therapies, or gene therapies, they address a specific target and try to turn the switch here. So if it is only one switch, if there are many switches that can be turned on or off, it becomes more and more complicated. And this led to the development of many new tools that are used as targeted therapies, as immune therapies, or as genetic therapies, and that are more and more combined in the recent years. Out of many patients, those are selected that would benefit most from a very specific therapy. And one well-known example is in those anti-cancer pathways. If one member of this pathway is changed, is mutated, like the EGFR receptor, then targeted therapies in form of antibodies or small molecules can address this specific target and change it again. So the system is known for already a long time with hormone therapies in breast cancer. Nowadays, we have these molecular markers in many solid tumors, but also in hematological cancers. And the new ones are the immune therapies that are coming up now. So this is the field of molecular predictive pathology that has to identify the targets that can be addressed then. This is important not only to identify patients who would respond to a specific therapy, but also to identify patients with a poor prognosis, patients with a high risk for a specific disease, or patients with a high risk of serious side effects during the therapy. And as you can see here on the right-hand side, there's a great potential also in economic terms. So it has two sides. One is to look at tissue diagnostics in this field, and the other one is to look into liquids. And as you see here, tissue diagnostics is already in the exponential phase, while molecular diagnostics in a plasma and serum is only still starting. So the point of companion diagnostics was pushed by the fact that for all new drug that is developed, also a new diagnostic tool has to be developed now to see whether a specific patient would respond to a specific therapy that is developed newly. This is not so easy because, as you see here, there's a great cancer heterogeneity. Already macroscopically, you can see that within a tumor, but also between tumor and metastasis, there are great differences. And these differences can also be seen on a genetic level. Nevertheless, until now, tissue diagnostics is the golden standard. This can be done at time of primary tumor or advanced tumor for diagnosis, estimating prognosis, or predicting the later therapy response. However, tissue diagnostics is invasive. And if we would take a less invasive tool like plasma diagnostics that is sensitive enough, We also could address all these items and also earlier recurrence detection and therapy monitoring. This is while tissue diagnostics only gives you a snapshot on a current situation, while plasma diagnostic is able to mirror the whole dynamics of tumor evolution.